So whenever the three treatment options for balancing, when teeth are non-bone, or they are not bone, or teeth are partially bone, some teeth are non-bone, or third is when teeth are maximum bone or maximum teeth are bone. Early age, definitely. Young age till 25 teeth will not be bone. So 15 to 25 generally मान लीजिए teeth will not be bone. So non-bone state पे. Then 25 to 45 partially some teeth will be bone, some teeth will not be bone, and above generally 45 to 75 maximum teeth will be bone. So in three conditions, mild, moderate, severe, we can divide them. Symptomatic ho, non-symptomatic ho, it can be combination of anything. In any one symptom can be there. It can be non-bone teeth, partially bone teeth, maximum bone teeth. Symptoms can be there which are extra oral. But the treatment options are only three. When teeth are non-bone in this condition, example, when teeth are like this, they are not bone, not a single tooth is bone. Not bone means the cusp tips are intact, the canine tip is perfect, the incisors are okay. So this is non-bone status. Alignment is so in this condition we have two options. One is simple alignment and balancing, and we just forget about the treat, nothing else required. We just see the bite where the bite should be, and we just align them. We can just align them with braces or aligners and balance them. Okay. Second option is if when teeth are partially bone. In this, if you see, the teeth are partially bone. I will show you. This is a bone status here. When teeth are partially bone, can you see this? This is partially bone. Okay, you see the indentation, the canine indentation. These teeth are partially bone here. So when teeth are partially bone, these teeth are not bone. Okay, I'll show you lower also. I'll show you lower. The teeth are, this canine is bone here. So when teeth are partially bone and some teeth are not bone, then what we do is we check the bite. We decide which bite is the best, and if you see this is bone and this is not bone, so when teeth are partially bone, this will be aligned with braces or aligners. We will move them and balance them. But this we need to restore. So this is known as restorative alignment. We cannot balance by aligning it, because aligning the bone teeth will further cause imbalance. So in this, if you see, I will restore this portion, and these will be aligned. The same scenario, I have to balance them, because from inside this is bone here, I will restore here. I will restore this much portion. Whichever part is bone, I have to restore it. So in this is a restorative alignment. First was alignment, second is restorative alignment. Third condition comes, which is more severe, is this. When teeth are maximum bone, patient comes with bone teeth, all over teeth are bone. You can see bone broken, you see all, and now and gone. So in this condition, the bite is imbalanced and teeth are wearing off. In this, we will just check the bite. This much is the deviation, this is the imbalance. I cannot align it by ortho, or means braces or aligners. I cannot move in front and do it. I have to restore and align. In this case, this canine tip has to be restored from here, and this canine tip has to be restored from here. So similarly, all of them I have to restore and align. This is known as restorative balancing. First was alignment and balancing, second was restorative alignment and balancing, and third is restorative balancing. So all three canals, in this example I'll show you how it has been done. See, this is the one, and what we finish is this. So this is after restoring each tooth, we have balanced it. We had to restore them. So this is a severe form. I'll show you in between the mild, moderate and severe. I'll show you one more case. So in this patient has bone teeth. You can see the teeth are bone. These are bone, and some are less bone. This is broken. This is slightly bone here. So, and if I show you lower, this is also bone. So this is bone, this is bone, this is less bone, and these are more. Now in this I cannot align them. I cannot align them. I have to restore and balance it. So we did restore and balance. This is C. Restore and balance. I restored it, all of them. Some only simply by adding some fillings on them. No root canal, no shaving of teeth. Just by adding on that, I have added on and balanced them. So they were once you balance them, the occlusal lock is created, canine guidance is created, there is no lateral or protrusive interference, and forces are distributed. So TMD symptom automatically go away slowly. Sometimes they take long time, sometimes they go very fast. So balancing is more important, whether it is worn teeth, non-worn teeth, partially worn teeth. So treatment options are defined. We cannot align worn teeth. Maximum aligner companies align worn teeth also. You have to remember, for worn teeth, you have to restorative balance, do balancing. You cannot do alignment only. Some are at middle age, whenever a teeth are partially worn, they have to be restorative alignment. Worn teeth have to be restored and non-worn teeth have to be aligned. Aligner companies are doing alignment only, that causes further imbalance. So only in one condition the best aligner treatment goes is when the teeth are not worn. Generally that is before 25 years. So aligners and braces are ideal before 25 years and they are not ideal after 25. Consider alignment only when you see your 3D scan and counter check that there are no teeth which are worn. In a worn teeth you cannot do alignment 100%. It has to be restorative balancing by adding it. You cannot align it. Okay, you cannot align it. Like this example I'll give you. This is a worn tooth, suppose. This is a worn tooth. If I want to balance it, you have to add on it. You have to add on it to balance it. And what aligner companies are doing is, they are with the braces on, they are aligning it. This is alignment, but worn teeth will also come in touch, but they are in a worn state. So worn teeth cannot be aligned like this. They have to be balanced by adding on the material on that. So don't get confused, don't get trapped by some aligner companies where they do alignment for worn teeth also. So see your scan yourself. When you see a scan and you mark them, tell them to mark your teeth which are worn. If you see multiple worn teeth, you are not a case for alignment, you are a case for restorative balancing, because of TMD symptoms. Just go and read about TMD. Symptom might worse over a period of time.